Meanwhile, in a major move to prevent the misuse of alcohol-containing medicines, the centre has tightened regulations around their sale and distribution. The government has amended the Drugs Rules 1945, bringing stricter controls on certain oral formulations containing high levels of ethyl alcohol. The Health Ministry has notified that medicines containing more than 12% ethyl alcohol and sold in bottles larger than 30 millimeters under Schedule H1 will no longer be available over the counter. The amendment has been issued through the Gazette of India, making these medicines subject to stricter prescription and dispensing requirements. The move comes amidst rising concerns over the misuse of cough syrups, tonics, and other oral medicinal preparations containing high alcohol content. Under the new rules, Schedule H1 medicines cannot be sold freely by chemists. Patients will now need a valid prescription from a registered medical practitioner to purchase these formulations. Pharmacists will also have to maintain a separate register documenting every sale of these medicines. Prescriptions and dispensing records must be preserved for at least 3 years and made available for regulatory inspection when required. The government says the amendment aims to create a uniform regulatory framework for medicines containing ethyl alcohol and ensure that such formulations are used only for legitimate medical purposes. We have Dr. Kanika Sood Sharma, Director and Clinical Lead of Radiation Oncology at Dharamshila Narayana Super Speciality Hospital in New Delhi. Thank you so much, Dr. Kanika Sood Sharma, for taking time out to be this year on News 9. This is a welcome move from the government, isn't it?
Absolutely. We all understand the implication of alcohol. If it is available over the counter, it definitely poses a risk of addictions. A lot of people have free access are likely to undergo, a risk of addictions. So it is a welcome move. We all know that this Schedule H1 has been in existence from 1945. It is just that these drugs with more alcohol content has come under its gambit. So it is a welcome move, and I think you have very well explained that there are a lot of implications. There is a need of a valid prescription, and the documentation of the sale also has to be very, very robust and readily available for audits. Another thing, I think as a clinician or as an oncologist, I'm quite happy with this move in the sense that we think that alcohol only causes addiction. Alcohol itself also is a carcinogen. So usage of alcohol around the clock through these medications poses other health risks as well. And not only cough syrups, a lot of alternative medications use alcohol as a solvent. So there again, alcohol has been used as a solvent to carry the main drug as a carrier. So these would also fall under this gambit. And I think it's a welcome move, as I've already mentioned.
Dr. Kanika Sood Sharma, just to be the devil's advocate, cough syrups tend to be the ones that people reach out for quickly without having to spend on an expensive doctor's appointment. Especially with the it could be a dry cough, wet cough, as the case may be. Cough syrups invariably end up fixing a lot of things that doesn't require a doctor's visit.
So yes, sometimes as a self-remedial, people do reach out to the chemist directly buying these medicines. This, again, it's also not a very good move. Many a times, certain diseases are just lingering on and self-medicated, and patients come to us ending up in very advanced diseases because they have been self-medicating. I think self-medication is not a good way of addressing diseases. It just suppresses symptoms and not the disease. But still, I think apart from alcohol-containing syrups, there are multiple other syrups which may help them in their day-to-day, mild remedies, which are basically lozenges-based or just symptomatic. So I don't think people will not have anything to their disposal in minor symptoms, but I would discourage this practice of suppressing cough by self-medication. As an oncologist, I see at least 8 to 9 cases of lung cancer in the city coming up, being treated for other reasons for cough. So, as a community, it is important to address the symptom, but at the same time address the disease.